Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for intervention testing, piloting, and staging. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Intervention Testing, Piloting, and Staging Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute the rollout of a new program or intervention. It does this by providing step-by-step guidance to conduct usability testing where needed, determine the need for piloting a new program or intervention and guidance to complete it, and finally, guidance on planning for staging and scaling up implementation of the new program or intervention. The intervention testing, piloting, and staging is broken down into 3 parts and 10 essential functions or tasks. And it's important to remember that not all agencies will complete all of the tasks in the brief, depending on their circumstances. And while the steps are presented in a linear way, in practice, often steps will overlap and they will be revisited as teams test, pilot, and stage. Part 1 is usability testing and includes creating a usability testing plan and then conducting usability testing, analyzing results, and making adjustments, covered in modules 2 and 3 in this series. Part 2 is piloting and includes determining the approach and developing a plan, identifying and recruiting sites, conducting the pilot, and then assessing results, reviewing progress, and making adjustments, which is covered in modules 4 through 7 in this series. And then part 3 is staging and scaling up, including developing or refining plans for staging the intervention and scaling up, covered in module 8, identifying sites and sequencing, which we will focus on in this module, before moving on to building capacity and scaling up, and then reviewing progress and benchmarks. Let's get started. Teams should build on previous work and decisions made in terms of establishing criteria for site selection and sequencing as part of staging and scaling up the intervention for full implementation. They should review the work that they completed during implementation planning and ensure that the decisions they make about sites and sequencing during implementation are captured or adapted as needed. Once teams decide on an approach for staging and scaling up the intervention, it's time to make the decisions on the initial launch sites and timeframes. Teams identify sites and sequencing to have a plan for where to implement the intervention and how expansion of it should occur. To establish a timeline and milestones for staging and scaling up the intervention. And to identify site readiness and the impact it may have on site and sequencing decisions and the supports needed to implement. Teams will need to think about scaling interventions in 2 ways. Horizontal scaling, which is moving into new areas, for example, new regions or counties, or perhaps other program areas in an agency. And vertical scaling, which is introducing changes at different levels of the organization. For example, changes in leadership functions, introduction of new policies, shifts in supervisor expectations, and new caseworker practices. Readiness is a key component when considering sequencing. Oftentimes, jurisdiction will prioritize sites that have sufficient capacity and motivation in order to stage the intervention successfully. It is important that teams consider the following when selecting sites to begin with versus those that may come later in the scaling up process. The availability of resources, knowledge of new practices, leadership stability, manageable caseloads to integrate changes, buy-in among staff and the community, or other capacity issues. During the time that initial sites are staging the intervention, there is opportunity for capacity to be built elsewhere, for example, through a hiring plan or shifting staff to needed areas, so that other sites will be ready in turn when to implement. Early implementation sites may also serve as supports and models for later sites. Teams should also consider the following factors when planning how to best scale up and sequence sites. Target population numbers. This provides teams an opportunity to prioritize those areas where needs are greatest and the intervention can have the largest impact. Diversity. By selecting early sites that reflect the diversity of the population, This will support efforts to learn about implementation in different types of settings. Availability of supports. Access to training, technical assistance, and capacity building services may be a factor in deciding how many and which sites are staged at one time. What are the personnel and organization structure or capacity characteristics that are most likely to successfully support implementation? Developing selection criteria to choose initial implementation sites that will support decision-making. And forming local implementation teams at each site to develop their plan, oversee all activities and timelines, and participate in communication loops with statewide or the larger implementation team. Teams will find it useful to keep in mind the 5 dimensions of organizational capacity and related considerations while staging and scaling up an intervention. Resources. Do selected sites have sufficient fiscal and staff resources in place for staging the intervention? Do program materials and guidance need to be developed and distributed? Infrastructure. What changes in infrastructure are needed to support implementation of the intervention? Does the pilot test point to needed changes in organizational structure, policies, protocols, or information management systems to support implementation? What needs exist for recruitment, selection, training, and coaching systems? Knowledge and skills. Do selected sites have staff with necessary knowledge and skills for implementation? Do recruitment, training, and coaching plans adequately support knowledge and skill building? Culture and climate. Do local leaders and staff support the intervention and its implementation? Do the agency culture and prevailing attitudes support new practices? Are the existing climate and staff morale conducive to change? Engagement and partnership. Are child welfare system partners and community stakeholders engaged in planning and staging the intervention? What helps teams to identify sites and sequencing for staging and scaling up of the intervention? Teams should consider the following questions. What are the criteria for implementation sites? Which sites are ready to stage early on? Which sites should be added over time? How will additional locations or populations be prepared? And how will varying levels of readiness be addressed? Answering these questions together as a team will help to identify sites and sequencing that support building a strong foundation of implementation over time and increase the likelihood of sustainable implementation efforts. Let's take a moment to check in on what you've learned about identifying sites and sequencing during staging and scaling up. Why do teams identify sites and sequencing? To have a plan for where to implement the intervention, a timeline for expanding it, and to identify how site readiness may impact decisions. How do teams identify sites and sequencing? By determining a scaling approach that fits the need, considering site readiness, target population numbers, diversity, and availability of supports. While staging and scaling up an intervention, teams will find it useful to use the 5 dimensions of organizational capacity as a guide. What can help teams identify sites and sequencing? Developing criteria for sites, determining which sites are ready early versus those to be added later, and having a plan for addressing site readiness. Now take this a step further by reviewing the reflection questions for Identify Sites and Sequencing in your intervention testing, piloting, and staging workbook to connect what you have learned to your own experience. Up next is Build Capacity and Scale Up, the 3rd essential function in staging and scaling up, and the 10th module in this series.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.